Good morning, everyone. Thank you all so much for being here today. My name is Janet Stolfi Alfano, and I'm the CEO of the Diaper Bank of Connecticut. We are here today with our wonderful partners at the Connecticut Hospital Association with state leaders and lawmakers to advocate for awareness about diaper need and to advance a statewide push to address diaper insecurity and increase support for the Diaper Connections program, which screens for diaper need at local hospitals and provides diapers to families through trusted community partners across the state of Connecticut. Today, you're going to hear from several folks about the health and economic impacts on a family when they cannot afford diapers. You'll also hear about how that need is growing and how this program, Diaper Connections, is working to build on existing community partners and community resources to connect families in need to diapers by screening directly at hospitals. That program needs support, and we need more diaper inventory and support for transportation as well. We're launching a statewide diaper drive to support the program in the short term, calling on our state partners to invest in the long-term future of this program. And if there is any ARPA funding or funding available for this, we would greatly support this effort to bring diapers to families in need through this great partnership. So you want to hear from the great folks behind me. I'm going to kick it to Dr. Selena Osei, and she's going to talk with you more about this need and how it impacts families.
Thank you, Janet. I'm Selena Osei, Director for Health Equity and Community Engagement at the Connecticut Hospital Association. Over the past 14 or so months, we have partnered with the Diaper Bank of Connecticut on an initiative to distribute diapers statewide through hospitals and their community partners. And during that time, I've learned a lot about diaper need in Connecticut, and I must say I've been quite surprised but also impressed by all the efforts that's been going on across the state locally to address this need. And Connecticut Hospital Association is very, very much honored to be part of this effort. And I want to share with you some of the lessons that I've learned to kind of help frame what this need looks like. 1 out of every 2 families have difficulty affording a sufficient supply of diapers for their children. Diaper need affects a family's ability to go to work and school and threatens the health of a family by increasing the likelihood of maternal depression, parental stress, and diaper rash in infants and children. Diaper need affects, diapers are an essential means to ensure diaper hygiene and prevent a range of avoidable medical conditions in infants and young children, including poor infant sleep, infant and child urinary tract infections, and diaper dermatitis. 1 in 4 caregivers missed work because they did not have enough diapers to drop their child off at childcare. And in most cases, as some of our members have spoken to us about, they're missing medical appointments because they can't find coverage for childcare. And missing work can average up to about $6,000 of lost income for a family. What I want to say during this Black Maternal Health Week, and today is the final day for those of you who are not aware, is, we have to recognize how addressing something as simple as diaper need can really influence the economic viability of our families in Connecticut. And I really hope you join us in this effort through this diaper drive to support the Diaper Bank of Connecticut in meeting their inventory supply and help support, because we've added on to the families they serve. We are serving about 3,000 children through Diaper Connections. And so this effort is really an effort we are putting on to address this need critically. Thank you very much for the opportunity to speak with you all today.
Thank you so much, Dr. Osei. Next, I'm going to have Representative Jillian Gilchrest, co-chair of the Human Services Committee, with a few remarks for you.
Great. Thank you so much, Janet, and the Diaper Bank of Connecticut, not only for the work you do, but for raising awareness about diaper need here in the state of Connecticut. You know, hearing those statistics just makes me think about the everyday, right? And there's so many families in this state who are struggling financially to afford their rent, to afford food, to pay for their electric bills. And when you have a baby, you should be able to celebrate that. But to have the fear of not being able to have an adequate supply of diapers for your child, that's where we see women, mothers, families experiencing mental health struggles, because that's a really overwhelming thing to experience when you are unable financially to care for your child. And then, as was said, you know, 1 in 4 families having to miss work. If you're already struggling financially and then you can't afford the diapers to be able to bring the child to childcare so you can go to work, it just gets you in this struggle, this cycle. And again, wow, the amount of intense emotions you would experience as a result of that. Not to mention the physical impact to the child. And as we were kind of joking beforehand, my kids are far now away from diapers. But, you know, if your child, I remember there was an experience on a plane, and it was my first flight with my child in diapers on a plane, and I made the weird decision not to change the baby for the flight. And when we landed, the diaper rash, you know, was so intense. And the shame and blame of that, it's hard to think that there's families that have to go through that because they economically can't afford to buy diapers. And so it's so vitally important that we have the diaper bank here in the state of Connecticut. And so please drop those diapers in the diaper drop on Diaper Day. But we also have a role as state government. And when I first learned about Diaper Connections, it just makes sense. And so thanks also to the Hospital Association for partnering with the Diaper Bank of Connecticut and all the hospitals across the state that are engaged in this important work. It's the first of its kind in the nation to screen for diaper need in hospitals and connect families to the resources they need. And so as we continue in these final few weeks of the legislative session, we want to ensure that if there are dollars available, and there are, we kind of always make jokes around here, we can find money. So if we can find those ARPA dollars to continue this important work, that's much needed. The other piece I've been working on, and am supported by the work of the Comptroller in the Human Services Committee, is ensuring that Medicaid cover diapers here in the state of Connecticut. And we've been having ongoing conversations with the Department of Social Services. We would be the first state to move in this direction, but I don't think that's a bad thing. I think that makes us a leader. And so we're looking at this point in time to determine for infants and toddlers, when it's medically necessary, can we have Medicaid cover those diapers for our youngest? And so we already do it for children over the age of 3 if they have a medical need. And so we're looking to expand that to below the age of 3. So we'll continue those conversations for the rest of the legislative session. But thank you again for bringing attention to this issue. And please know you have an ally in me. Thank you. And then I do have to head off to session. So thank you.
Thank you so much, Representative Gilchrest. The state is much better because you are helping lead it. Thank you. Next, I'm going to bring to the podium Comptroller Scanlon.
Thank you. Well, good morning, everybody, and thank you so much to the Diaper Bank and to CHA for their leadership on this. This is not a luxury. This is a necessity for parents like myself, who are the parents of young children who are still in diapers. And we're here today because we want to make sure that everybody in Connecticut who needs these to care for their children has the access to them that that child needs and deserves. And for too many families in this state, that is something that they spend a lot of time wondering about and thinking about and worrying about. And as Representative Gilchrest just said, at an economically difficult and confusing time when families are having to make tough choices as the price of goods rises. We don't want anyone to have to make that really impossible choice of whether they put food on a table or they put a diaper on their kid's body. And so today, I'm really proud to be here as the only statewide elected official in Connecticut who has young children in diapers to support and put my full weight of my office behind the statewide diaper drive so that folks really can get the help that they need. And I want to use my platform to ensure that as somebody who certainly understands how expensive they are, but is fortunately in a position where I and my wife can afford that, knowing that far too many people in our state cannot. And so today, I'm proud to be here to support the great work that's already happening, to again reiterate my thanks to the Connecticut Hospital Association for their leadership on this, and to urge the people of Connecticut, now is the time to donate and help this great cause to make sure that everyone has the resources that they deserve and that these important necessities are made available to those that truly need them in our state, of which there are far too many people, and they are in each and every city and town in this state. This is something that does not differentiate by zip code. This doesn't differentiate by daycares. Everyone you know and somewhere you live, somebody is affected by this. This diaper drive is going to help. The policy that Representative Gilchrest just talked about can be transformational, but at the end of the day, we have a simple goal: make sure everyone in Connecticut gets the diapers that they need, and we're asking for the people of Connecticut to help us in that effort through this diaper drive. Thank you all.
Thank you so much. Thank you so much, Comptroller Scanlon, for your leadership in bringing together and convening advocates around women and children's health. Thank you so much for your work. And I have the distinct pleasure of introducing Senator Anwar, who is, we're so thrilled that leadership and physicians understand that this is a public health issue, and he represents many committees, including public health. So thank you so much for your leadership, and please join me at the podium.
Thank you so much. Thank you so much, Janet. Thank you for Diaper Bank and the Connecticut Hospital Association for your leadership in taking care of this very, very important responsibility that we have. I just will add something else that is worthy to mention. I'm going to use this again as a prop. Look at this, and then you think that it's just a simple little diaper, but there's far more to this. The far more part is, and I'll just make this connection so you understand, the children who do not have diapers are not going to be able to be part of early childhood education. And if a child is not going to be able to be part of early childhood education, they are not likely to be able to get higher education. Anybody who goes through early childhood education centers is 2.5 times more likely to have higher education. If you make those connections, it starts from the moment you're born is when the care that you receive and all the dots that connect are going to connect to your future. And this is that critical an issue, that we are deciding the fate of the next generation based on the generation's ability to have diapers. And we can fix that. And that's the direction, the trajectory that we should have. For having to do this in 2024 in the state of Connecticut, it's worthy for us to reflect that this is a symptom of a lot more that's going on. And the lot more that's going on is that in the Alice community, the working poor, that's 39% of our population, and that population is increasing. When you hear that 1 out of every 2 families cannot afford a diaper for their children, or they're making the choice because they are trying to make sure that the kids are fed, we have a lot of work to do. And this is, again, a way of hopefully addressing the important issue, but using this opportunity to say that we need to be striving towards policies that we should be doing other things over here rather than trying to get a diaper bank to be functional. So thank you for all the work each and everyone does. It's an honor for me to be part of this. This is part of a public health. This is part of our well-being. And this is all connected. It's fascinating how all these things are connected. So thank you for doing this. Thank you.
Thank you. Thank you so much, Senator Anwar. And thank you, Representative Ackert, for joining us. If you'd like to share a few words. And thank you for bringing diapers. We appreciate it.
Absolutely. Thank you. Thank you. Yeah, I just wanted to stop by. I've been supportive of the Diaper Bank for a long time, and since we really had this initiative over and over each year. But it's staggering on the prices that a family has to go out and purchase. That box alone, $27. When you think that's real dollars. When someone has to go out and, has a small one, as a grandpa now, I know when they ask, well, we could get us some diapers. You ask, what did the kids need? Could you pick up some diapers? This is the size, this is the brand. And so you start to really feel the financial impact that a family has. And this effort is truly laudable, and I look forward to supporting it in any way I can. So thank you. Thank you for allowing me to say some words.
Thank you, everyone, for joining us today. Again, I want to thank the Connecticut Hospital Association. Oh, I'm so sorry, I almost forgot you. How could I forget? One of our key partners in the distribution through Diaper Connections from Connecticut Children's Medical Center. Luis Rivera is their Community Relations Manager at Connecticut Children, and they're a key partner in the Diaper Connections distribution. Please come forward. Thank you.
Thank you. I'll be brief, but I'm enjoying the opportunity to be able to be here before you and talk a little bit about Diaper Connections. So I work at Connecticut Children's Medical Center, and I'm the Community Relations Manager there. And in my work, I see a lot of need in the community. And diaper is one of the biggest social determinants of health for our families. And when we were approached by Connecticut Hospital Associations to join in the Diaper Connections program, it was a big blessing for us because now we had additional resources that we could be able to provide diapers to the families in Hartford, in Connecticut, that needed them the most. Through that program, we were able to serve up to 3 million diapers given to up to 3,000 children in Connecticut. This program, the Diaper Connections program, was started through a grant from the Department of HUD, and it's being supported or run by the Diaper Bank of Connecticut. Unfortunately, the program has limited budgets and limited amounts of diapers available to continue to support the Diaper Connections program. So my ask is for the legislators to continue to financially support the Diaper Bank of Connecticut so that we can continue the Diaper Connections program and continue to provide the diapers that our low-income families need. Thank you.
Thank you so much, Louis, for your leadership and your work on this issue. Now, I want to thank everyone for joining us today. Our leadership, the Comptroller's Office, our legislators, CHA, for being such a wonderful partner in this work. We really cannot do it without the support of everyone here and everyone outside of here. This is a need that lives in your community, and I will point out that we have packets that are by legislative district that actually show the need in each of the communities in the state of Connecticut. If you think that it's not happening in your neighborhood, you are incorrect. This is impacting families throughout the state of Connecticut. In big cities, in small towns, in rural areas, in suburban areas. This impacts families that you know. So please do what you can to help us support this work and continue this program moving forward. And thank you so much for your time today.
Thank you.